So this ECHELON-2 study is a very important study because it is the first really large study that has been done in a randomized way, comparing standard treatment, which is CHOP, to a modification of CHOP, which is the use of a modified CHOP with brentuximab vedotin. And what it showed in the preliminary analysis was an improvement in progression-free survival and overall survival. And this updated 5-year analysis, so with an extra 2 years, we have demonstrated that this improvement in progression-free survival is clearly sustained, and there's also a sustained improvement in overall survival. Specifically, the PFS shows a 30% reduction in risk of progression events, and the overall survival shows a 28% reduction in the risk of death when you add brentuximab vedotin to a modified CHOP regimen where the vincristine has been dropped. So really, this was a practice-changing study when it was first published. And I think this study really gives us a lot of reassurance as to the long-term benefits of adding in brentuximab vedotin. Because unfortunately, unlike B-cell lymphomas, T-cell lymphomas do relapse more. And the issue was the improvement going to be sustained, or were we going to see a drop in the Kaplan-Meier plots? But we're not seeing that, and that plateau seems to be sustained. And so we're very optimistic that we will sustain that cure rate. One of the most important aspects of this study was the subgroups of the peripheral T-cell lymphomas. So as we know, PTCL is a heterogeneous group that's made up of peripheral T-cell lymphoma NOS and anaplastic large cell